Hello everyone. I'll be start first of all by introducing myself. I am Dr. Chesta Agrawal. I am I am a dermatologist practicing in Jaipur. I did my MBBS from Manipal University and I did my MBBS from Manipal University and I was third ranker and a distinction holder. I got through NEET PG examination with All India rank 261 and then did my post graduation from Government Medical College, Udaipur. As Udaipur is my hometown, so I chose that medical college for my post graduation. I have many publications in various indexed and national as well as international dermatology journals, as I have a habit of reading and writing. And recently, I have received a Best Original Article award in an international conference held in Bangalore 2018. This was named as Dermacon, which was held in 2018, January, November. Now, I have faced many problems when I was preparing for my pre-PG examination. So, I will here discuss few of them. The most important one is what to read and what to leave. This is a very important question many students face. As we know, we have a very vast syllabus of total 17 subjects and each of them is very important for us. So how much time to give to these subjects is a key for your NEET PG preparation. We cannot just read each and everything and we think that we can answer. This is not possible. So we have to make a weightage area that what to read and what not. Students usually spend a lot of time on subjects which are not so important from the exam point of view. And this leads to something called as wastage of time, which is not at all acceptable while preparing for NEET PG, as you have very limited time and a vast subject. So all exams have pre-decided set number of questions from each subject. This is given in the exam sheet that how many questions will be coming from a particular subject. It is usually different from all the exam to exam and all the subject to subject. We should decide our timing depending on the weightage of the questions we are getting from that particular subject. So this is a very important thing to decide what to read at what particular time. The second is unable to solve the MCQ questions. Even after studying for hours, we are not able to recall the important things. So this is very important that we have to at least answer the questions. Or say we are not able to crack the multiple choice question. It is very important to remember the exact point or say any value. Like if they're asking the diameter of skin or they're asking the number of cells. So that exact value is very important to remember. And it is very important for us, we need to revise it all the points just before the examination. Otherwise, we'll easily forget it. So the next important thing is, here comes the importance of the notes. It is a very important thing. What is notes? These are something very handy and short to be read at the last moment. So students have to make their own notes so that they can easily read it just before the examination. Because there are few values which you cannot remember all the time. You have to just freshen up your memory just before the exams. So it is very important so that you can easily crack your MCQ questions. Now, the third problem which we face nowadays is clinical based questions. As nowadays, these exams are computer based. So in computer based examination, students usually get clinical picture. They can get a X-ray picture of the patient. They can get the clinical picture of the patient or any investigations like ECG report or EEG report, anything. So nowadays we get many questions with a short clinical history with clinical picture given, and based of them they have to ask the diagnosis or management. They can even directly ask you the management. Like for example, in dermatology nowadays they give you question, they give you a photo of a picture, a patient with multiple flaccid bullae or multiple tense bullae presented to you, and the next thing is they have given you the immunofluorescence study without even telling that what disease exactly we are dealing with. So they ask you that what depending on this investigation and this clinical history, you have to tell about the management of this patient. So it is very difficult because this is a clinical based question. And nowadays, because we are answering the questions on the computer, so it is very easy for them to give these kinds of questions. And many of the students face this problem because these students, because it is very difficult because students have very limited exposure during your MBBS course to the clinical postings, and you do not tend to see lot many of cases while your MBBS examination. But actually, the truth is, these questions are very easy to solve. You just need to read them properly. As in these questions, everything is given in the question or the picture itself. You have to make your own clinical points, or you have to just find out the keywords in these questions to solve this question. So it is very important. In these cases, you tend to get these kind of questions. So try to answer them. So as we know that we just have to learn the key point of these important questions. So students, I'm here to solve all these issues of yours. I will give you all the tips and tricks to crack the NEET PG examination very easily, very smartly, and to give your best in the minimal possible time. I will teach you like what you have to read, what notes you have to make for your last moment, so that you can only read those questions and you will not waste your time reading the whole chapter or reading the whole book, so that you can answer your questions very easily. I'll be teaching you a very important subject, that is dermatology. From dermatology, you get for sure 8 to 10 questions in your examination. Especially if I talk about NEET PG examination, 8 to 10 questions are very common from dermatology. This constitutes about 10% of the total. So this constitutes about 10% of the total medicine questions, which have a very good weightage. So from this 10%, you can score easily 100 out of 100. All the 8 to 10 questions is very easy to solve. So in this NEET PG computer based pattern, the most important thing which we have to keep in our mind is we have to read all those subjects, all those short subjects which gives you important point, or which make you score lot and lot more, because they have very predicted number of questions. They do not have any new questions. You just get questions from around and around. So you have to answer all those questions, and we cannot take a risk to just miss that question. So please do watch my live classes on Unacademy platform, and I will be coming on this 3rd at 10 a.m. in the morning. So please come and watch my live classes at Unacademy teaching platform, and I will be live on 3rd April at 10 a.m. So thank you, and let's crack it.